Welcome to our last lecture of our four-part series on EMS documentation. In lecture 4, we're going to be covering the patient refusal and the importance of proper documentation and really the importance of proper patient care in attempting to persuade that patient to seek further medical treatment. In this lecture, we're going to discuss what you need to do when you encounter a patient that needs medical attention and transportation to the hospital, but refuses both of those. These situations can be some of the most frustrating calls you go on, and I can attest to that. But they can also be some of the most important because of the potential legal issues that may arise from these kind of calls. We're going to cover how to handle these situations and also how to do proper documentation. Now, like I said, lawsuits in EMS have been steadily increasing over the years, and a few studies show that anywhere from 50 to 90% of EMS lawsuits result from patients who are evaluated by paramedics and not transported to the hospital. And as you get out in the field and once you begin your clinicals, you're going to see these calls are very, very common, and they can range from patients that simply sometimes may not need to go to the ER but need just to be evaluated. And sometimes they can be patients who are obviously having some kind of life-threatening illness or injury, but for whatever reason decide that they do not want to go to the hospital. And it is our jobs as paramedics and EMTs to attempt to persuade these patients with every resource that we have to seek further medical evaluation and attention. And if they continue to refuse, we have an obligation to ourselves really to make sure that we show that we did the best that we could and that the patients understood what they were doing whenever they refused treatment and or transport. Really, proper documentation is going to be your best defense from any kind of lawsuit. We covered that you may be brought up in lawsuits up to 7 years later, 7 to 10 years later. It's going to be your documentation that you have to, one, refresh your memory and to show that the patient really understood what was going on and that they were accepting full responsibility when they refused transport. I've spoken to a number of people that have been to court over people who refuse transportation or transport with the EMS agency, and a few of them, because of their documentation was so good, only their PCR was subpoenaed and used in court, and they never even had to go testify because their documentation was that good. And that's something that I want to strive for personally, and I really want our students to strive for, that even during a clinical setting, that they could do proper documentation and go ahead and be prepared so when they graduate and then they're held responsible in these situations, that they are capable, that you guys that are watching this right now are able to do proper documentation and really protect yourself, because no one wants to see situations like this. No, these are just horrible. But they're a fact of our field. They're a fact of life now, and we need to be prepared for them. A quote by a gentleman named Gene Gandy says, "Documentation must prove on its face, in writing, the patient's then present capacity to understand and appreciate fully the nature of his or her condition, the choices available to him or her, and the possible consequences of refusal." I felt like that quote just summed the importance of documentation and patient refusals up in just that one sentence right there. Now, when dealing with patient refusals, you never want to attempt to dissuade a patient from going to the hospital or attempt to talk them into going POV or per their own vehicle instead of via the ambulance, regardless of how minor you might feel their complaint or their injury is. This is very dangerous. Sometimes you may encounter a patient that you feel does not require transport via an ambulance, or that you may feel is not quite as important, or it doesn't quite meet the emergency criteria that you have set up in your mind. However, there's a lot of things that could happen that you may not understand, and that we really don't have the equipment in the field to assess and say, hey, this patient is doing okay. So if a patient ever wants transport, for whatever medical reason, you never want to attempt to talk them out of going to the hospital or attempt to talk them into going by some other means. If they want to go via ambulance, you need to take them. Because it's better to err on the side of caution than to risk a potential lawsuit, or more importantly, that patient's health. Remember, once we show up on scene, we are that patient's advocate, and it is our job to ensure that that patient gets every high quality level of care that is available to them. Now, when you're on these specific calls, it's important to ensure that if you feel like the patient needs medical attention, that you make every effort to persuade them into going to the hospital. There are a number of reasons that I have experienced while in the field that patients may not want to go. Some of them may be afraid to go to the hospital. Some of them may fear that it'll be too expensive. Really, money is not what you need to be focusing on, or what the patients need to be focusing on when they're having a potential life-threatening injury. Because if they die from it, really all that money is not going to help them at all. So really our job is to educate in that setting. We need to help be the voice of reason a lot of times when patients need medical attention. We need to talk them into this because, like I said earlier, we're really the patient advocate. And if after all of your attempts to persuade that patient, if he still refuses, we are able to contact our doctors in the ER, online medical direction, and a lot of times they are more than willing to speak with that patient. And sometimes having, that title of a DO or an MD, gives you a little bit more weight when you start talking to patients. So if you can sometimes get the patient to speak with their with your medical director, or even sometimes family members, if you can call, their mother, or if somebody there on scene that's related, sometimes they're more likely to listen to them than they are to EMS. And if that still doesn't work, sometimes having someone that they respect, such as a doctor, tell them, hey, it's really important that you come in to get checked out, is enough to get them to go. Now, when a patient is refusing transport, it is your ethical and legal responsibility to ensure any patient that refuses treatment and/or transport understands what the potential risks are and that the patient is mentally competent to make such a decision. You may be faced with a patient who states that they do not want to go to the hospital, but due to their mental status, they're not mentally competent to make that decision. That if they were in their right mind, or if they really understood what was going on, they would elect to go to the hospital. These are patients such as head trauma patients, patients that are post-ictal, that are disoriented. For whatever reason, there are many times where you may find a patient who says that they don't want to go to the hospital, but because of their injury or because of their mental condition, they're not really competent to make that decision. And this is a very delicate place to be put in. You'll also find some times where ensuring that the patient is competent to make that decision is very difficult, because the patient will not allow you to do any form of assessment or give you any kind of information. In that case, you must be very careful to document every effort made and the patient's response to that effort. However, generally, with a little bit of persuasion, patients will allow you to do some kind of assessment or attain a little bit of a sample history. So if a patient says no, as far as like maybe you want to take their vital signs, but the patient doesn't want you to do that, maybe you can at least get a little bit of a history. So that way you can start to kind of understand a little bit more about what's going on, see if maybe they are fully aware of what the risks are, but are still deciding that they don't want to be treated or transported. Or maybe they may have something that is causing that, and obtaining that history can help you identify maybe irrational thoughts, or even identify possible medical illnesses or injuries that could cause them to not be thinking rationally. And then you want to document everything in your assessment and everything that your interview reveals. It's very important in these situations. When writing narratives, really the patient refusal sometimes is one of the longest narratives that you're going to have to write, because to properly cover yourself and to properly show that the patient, one, was competent to make the decision, but two, also was fully aware that he or she may die or whatever the potential risk of refusing transport are, that they were fully aware of that. So that takes a lot of writing and that takes a lot of effort on your part, but it's worth it. Now in your documentation, even with the patient refusal, you need to make sure that all of your documentation is still in the chart format. Now, once you get your chief complaint, what you were dispatched as, you get a little bit of a history, you do the best assessment that the patient's going to allow you to do. Everything that you say with the patient, all of your persuasion needs to go into the R portion of your chart format, or the treatment portion. And all of that documentation needs to include any assessment that you did, and of course its findings, any advice that you gave the patient, any advice that if you contacted a medical doctor or your medical director, and any advice that they gave them, all persuasive efforts, any patient statements, especially if they stated something to the effect that they understood that refusing transport could lead to their further injury, to their death, whatever it may be. And if they'll allow you to get a set of vital signs, you need at least one full set of vital signs. And I would suggest, if you don't already include a blood glucose level in your vital signs, to make sure that you include that in there as well. Your documentation also needs to include clinical information that clearly indicates that the patient is capable of making that informed decision. This would be their alert and oriented status. Of course, the blood glucose level that I just mentioned is going to play a big key, stating that, of course, they weren't having any mind-altering illness such as hypoglycemia. You need to get a release of liability form signed, and as they're signing that form, you need to explain to them what it states. Typically just stating that EMS is not held liable for them electing not to go to the hospital should anything negative happen. That form needs to be signed by the patient, and you need to get a witness. Now, preferably, if they are around, you want to try to get a relative or a bystander, someone who, should it come up in court, couldn't be shown to be biased. Of course, if they're willing to sue EMS, but perhaps their mother is the one that signed the refusal, they might be less likely to state that their mother was lying about that, or that their mother, for whatever reason, signed that without knowing what was going on. But if we get someone like your partner or like a law enforcement agent, then during a lawsuit, they may state that they were on our side. If it was a firefighter, they were just trying to help us out. It doesn't really show that it was on their side. So it's better to have, of course, a relative, and if not a bystander who was not related to EMS in any form. You need to print the witness's name and obtain any contact information for a later reference with that person, should there be any kind of legal action taken. You need to be sure to inform the patient that they may call 911 again at any time. So if you leave and you get 5 minutes down the road and then all of a sudden they decide that they want to go to the hospital, that they don't need to feel a fear of calling you back. You need to make sure that you explain that you are very comfortable coming back should anything change. And something else that's important is it's good to give them some signs that they may need to look for, or say they're with someone, a friend or a family member. Go ahead and start talking to them and say, hey, if these are some signs that the patient's condition might be worsening. Say if someone falls and hits their head and is knocked out, and now they don't want to go in for evaluation, you may want to speak with them and whoever you're leaving them with, and start talking to them about what some potential signs of a worsening head injury might be. So that way, should those happen and the patient's condition deteriorates, well, then they can call 911 then, and then they may not be competent to make such a decision as refusing transport. Now, in summary, like I said earlier, a patient's refusal can be one of the most challenging situations that a paramedic can face, but it's not impossible, and any paramedic that is prepared can protect himself from any kind of lawsuit with proper documentation. If the patient truly needs further treatment and evaluation, we must use every available resource to try to convince him or her to seek that care that they need. It's very important that we always view ourselves as the patient advocate. Well, that concludes our 4-part series on patient documentation. A lot of this is very general. Of course, there's more information as you advance in licensure and certification. There's a lot of information that needs to be included on specific details, on specific procedures. However, I feel that this 4-part series should give you a good foundation. In EMS, we always have to continue to be good students. We are always learning. Our field is always changing. And if we keep that in mind, that in our documentation, if we didn't do it, if we didn't document it, we didn't do it, and that we are always a patient advocate, those 2 keys are going to help us have the drive to do that proper documentation. Well, good luck on all of your documenting now. I look forward to reading those narratives and being with you guys as you go throughout your clinicals. If you have any questions, please feel free to email myself or Brandy McCoy. Our contact information is in the syllabus. We have it online. It should be paired with some of these lectures. If you have any questions or concerns or anything that you'd like to add to this, please feel free to contact us.